Hello everyone, welcome to this video where my colleagues and I will talk about the absorption and metabolism of vitamin B12 in post-gastric sleep surgery patients. We will review the research information and the model created by the team. So let's get started. Bariatric surgeries involve surgical procedures designed for weight loss and the improvement of conditions associated with obesity. They are performed with small incisions using minimal invasive surgical techniques. There are many of them, but we will only focus on one, the gastric sleeve surgery or sleeve gastrectomy, which is one of the most common and popular operations today because it's simpler to perform and has lower morbidity compared to other surgeries. It is intended for patients with a body mass index or BMI equal to or greater than 40 or a BMI equal to or greater than 35 with at least one obesity-related disease, such as hypertension, diabetes mellitus, among others. On many occasions, this surgery has been recommended for individuals who have failed to lose weight. This laparoscopic surgery also involves the removal of approximately 80% of the stomach. According to the American Society for Metabolic and Bariatric Surgery, ASMBS, the remaining stomach is about the size and shape of a banana, and as a result of this, the production of ghrelin, better known as the hunger hormone, decreases significantly. Additionally, the organ stores less food or liquids, leading to a reduction in caloric intake, which, in combination, can contribute to weight loss. According to a study that gathered qualitative and quantitative information from more than 40 sources about the nutritional consequences of roots and why gastric bypass and sleeve gastrectomy in patients, a lower impact was found on the nutritional status in those with a sleeve gastrectomy. That's one of the reasons why this kind of surgery is the most common practice in the United States of America. Still, several studies have shown that micronutrient deficiencies are commonly found after bariatric surgery.
For that reason, we have proposed to analyze the impact of gastrectomy sleeve surgery on the metabolism of vitamin B12 through a literature review on the subject for its respective nutritional approach. Also, to create a representative model of gastrectomy sleeve surgery to understand its nature, and finally to investigate the functioning of intrinsic factor to understand its role in the absorption of vitamin B12. Bariatric procedures may increase the risk of vitamin B12 deficiency because of so many factors, and despite the use of supplements, long-term deficiencies persist after surgery. Vitamin B12 deficiency, if discovered late, can lead to irreversible neurological damage and has also been related to macrocytic anemia. The main symptoms of vitamin B12 deficiency include pernicious anemia, numbness and paresthesia, tongue pain, and axonal degeneration, especially of the peripheral nerves, the spinal cord, and the brain, having in the latter the development of tinnitus, depression, and dementia. Laboratory tests such as serum B12, which normal range is between 200 and 1000 pg per millimeter, are used to detect its deficiency. Additional indicators of deficiency include having elevated results for serum methylmalonic acid and serum homocysteine. That is why monitoring these markers is recommended every 3 to 6 months until 12 months after surgery, and therefore annually.
Many anatomical and functional changes occur in the digestive system because of the nature of bariatric surgeries. Patients who have undergone sleeve gastrectomy, where a significant portion of the stomach is removed, face a reduction in the size of their gastric reservoir and accelerated transit time of nutrients. Bariatric procedures affect the digestive system's ability to properly process vitamin B12, mainly due to insufficient intrinsic factor secretion, low gastric acidity, and even reduced storage capacity in the liver, contributing to long-term nutritional deficits. Vitamin B12 deficiency after bariatric surgery largely depends on the type of procedure performance. Non-adherence to supplements caused by factors such as post-operative vomiting, change in eating habits, and the high cost of supplements significantly contributes to micronutrient deficiency, being more pronounced in patients who do not follow adherence recommendations. Other contributing factors include pre-operative dependencies, post-operative food intolerance, or eating habits, vomiting, change in taste, and eating partners. The primary document cause of vitamin B12 deficiency after the laparoscopic sleeve gastrectomy involves the removal of the gastric fundus, which results in reduced intrinsic factors production, leading to compromised absorption of this vitamin. The reduction of gastric hydrochloric acid productions and the change in volume and composition of food intake can also lead to a deficiency.
Now, we're going to talk about the organ structures. First, we have the stomach, which is an organ that has a dish-shaped form and is a muscular bag in the frontal plane, located at the top of the abdomen, which volume can increase from 25 milliliters before eating to 1,500 ml after ingesting food. The stomach can be divided into three sections: the fundus, corpus, and intestine. The fundus can relax to expand its size upon the arrival of ingested food, while peristaltic muscular contraction from the corpus to the pylorus allow the trituration and eating of that food. For this reason, the stomach is the place where food is mixed and diluted with gastric juice to promote catabolic reactions and generate simple molecules. Therefore, this organ can perform chemical digestion with the help of enzymes and mechanical digestion through muscular contractions. The stomach is the most important part of the model. It will be made with a removable section to represent the sleeve gastrectomy. Now let's talk about the R proteins. There are proteins that can be found in saliva, plasma, and gastric juices. They can also be called covalaphyllin, and their purpose is to bind the cobalamin from food in the stomach. Now we have the parietal cells or oxygen cells. These types or cells are located in the gastric body and fundus, and they're responsible in the production of intrinsic factor, a glycoprotein which is essential in the transportation and absorption of vitamin B12 by the terminal ligament. The model will represent the functioning of the cells after a sleeve gastrectomy. Next one is the duodenum. It is the first portion of the small intestine, responsible for continuing the digestion that took place in the stomach with time. It involves multiple digestive enzymes accompanied by intestinal juices and fluids from the liver, gallbladder, and pancreas. Duodenum permits hydrolysis of our proteins by pancreatic proteases to release cobalamin and allows its binding with intrinsic factor. Finally, we have the ileum. The ileum corresponds to the final portion of the small intestine, measuring approximately 3 meters. Its main function is to absorb nutrients that were not absorbed earlier, especially vitamin B12. The cells of the ileum have special receptors to recognize intrinsic factor and facilitate the absorption of this vitamin. This part will be represented in the model to visualize the absorption process.
Now, I'm going to talk about the sketch function of this model. Okay, this model has the ability to separate a portion of the stomach to simulate as gastric sleeve surgery. First, a complete stomach can be observed with a good production of hydrochloric acid, that are the red rectangles as we have here, and can be observed in the stomach. And we have an intrinsic factor, the blue triangles. Additionally, we have large brain masses can be seen simulated ingested food containing cobalamin. Likewise, the rest of the digestive tract is visible. But due to the chosen focus of the topic, explanation will only would be considered up to the ileum, which is the main portion where vitamin B12 is absorbed. Now we have the same stomach, but now it's already updated with a detailed version simulating the performance of a gastric sleeve surgery. And consequently, this stomach will produce a lower amount of intrinsic factor, causing problems in the absorption of the vitamin B12 in the ileum. Okay, now the materials that we use for this model are polystyrene foam as the base, and for the body, paints, markers, cardboard, foam, silicone to paste all things, scissors, pencil, wooden stick for this, and Velcro to paste and separate the stomach, and wool for the intestine. Okay, now how we build this? The first step was to plan the arrangement of the organs on the polystyrene board, on the polystyrene foam as the base, considering the involved parts of the digestive system and their respective locations. Now, the foam board cut to shape the organs, each organs, and these were placed in the body in the polystyrene foam with silicone. Also here we use roller and pencil to make sure the location of the organs were in the correct place. Now, for modeling the organs with foam, we use a foam to represent the organs, shaping it to resemble the real organs. The stomach was created into parts that can be separated, simulating a gastric sleeve surgery, as I already explained. And now we have the anatomical details. For this, we add the organs using foaming, using multiple markers, paints to represent various layers of the stomach and the other organs. And now for the realism and textures, foam and wool were used to recreate realistic textures simulating organ surfaces such as intestinal villi and the rugosities of the stomach and blood vessels were also added to enhance the realism. Now for the stomach division, this part, the most crucial of this model, we model with foam and we use a simple mechanism such as the Velcro to easily join and separate the parts of the stomach. And that's all. Thank you.